Hello everyone, today we will be talking about periodontal ligament, the various fiber structures and cells that are present within the periodontal ligament. So periodontal ligament, as we know, is an important part of the periodontium which helps in supporting and investing the teeth within a bony socket. So periodontal ligament has a lot of functions, mainly to absorb the shock which befalls on the tooth during masticatory action of mastication, the masticatory load, to provide anchorage for the tooth in the socket, among some of the important functions. So we will be seeing which all are the fibers and the cells which are mainly present within the periodontal ligament. So the important components, different components which are present in the periodontal ligament include fibers, different types of fibers, cells, about which we will be talking about today. There will be a ground substance, there will be an amorphous ground substance which will be present on which the fibers and the cells will be arranged on. There will be blood vessels, nerves and cementicles, which are age related structures which can also be found in periodontal ligament. So we will be concentrating more on fibers and cells present in periodontal ligament. And just like most of the connective tissue, majority of the fibers present in periodontal ligament are collagen fibers. So collagen fibers are present, elastic fibers are present, and then there are immature elastic fibers known as oxytocin and ilianin fibers present in periodontal ligament. So collagen fibers are the most important fibrous component of the periodontal ligament. Collagen fibers are high molecular weight proteins, which usually these collagen molecules, they are found as triple helix structures which aggregates together to form microfibrils. As you can see in the picture here, this is made up of bundles of microfibrils. They aggregate together to form a fibril structure. And many of these fibril structures, they will arrange together to form a fiber structure, one fiber structure. And many of these fiber structure, they join together to form collagen bundle structure. So that's the way the collagen fibers are arranged. There will be a lot of microfibrils which bundle together to form fibrils, which then will bundle together, many fibrils will bundle together to form collagen fibers, and many individual collagen fibers will then bundle together to form collagen fiber bundles. So the major types of collagen present in periodontal ligament are type 1, type 3 and type 12 collagen fibers. Type 1 collagen fiber is the most commonly found type of, most abundant type of collagen present in the periodontal ligament. We can divide these collagen fibers based on their functions. We can divide these collagen fibers into two types: principal fibers and accessory fibers of collagen of periodontal ligament. So first we will be talking about the various groups of principal fibers. The principal fibers are the collagen fibers which plays the most important roles in collagen in periodontal ligament. So there are mainly 5 groups of principal fibers of collagen fibers in the periodontal ligament. They include the alveolar crest group of fibers, horizontal group of fibers, oblique group of fibers, apical group of fibers and interradicular group of fibers. There are 5 major groups of principal fibers and we will see each one of them separately. First one is alveolar crest group of fibers. This alveolar crest group of fibers, they are fibers which radiate from the crest of the alveolar bone to the cervical part of the cementum. Okay, they extend from the crest of the alveolar bone. They extend in an upward direction and insert themselves into the cementum just beneath the cemento-enamel junction. So they start from the alveolar crest, proceeds in an coronal direction and inserts into the cementum just beneath the cemento-enamel junction. Now the direction in which the alveolar crest group fibers extend in is very important for its function because it prevents extrusion. The major function of alveolar crest group fibers is to prevent extrusion of the teeth within the socket. It prevents the extrusion of teeth within the socket. Now how they do this, just remember the direction which the alveolar crest group fibers extend in. Now just imagine this kite. We are holding this kite using a string. Now if the kite tries to move upwards, it's trying to go upwards, we will try to resist that force by holding the string in this particular direction and exerting a downward force, so that we can bring the kite downwards or at least prevent it from going upwards. So similar action takes place, similar role is played by alveolar crest group fibers, in which this particular direction of the alveolar crest group of fibers helps in preventing extrusion or upward movement or movement of the tooth away from the socket. So it pulls the tooth back into the socket. So the major function of alveolar crest group of fibers is prevention of extrusion. It also prevents tilting of the tooth and also resists lateral movements. Next group of principal fibers are the horizontal group of fibers. The horizontal group of fibers, as you can see in the image and as the name suggests, they move in a horizontal direction. That is, they will be at right angles to the long axis of the tooth from the cementum. They extend between the cementum and the bone, and they will be at right angles to the long axis of the tooth. So they will be horizontal in direction, and they join the cementum just apical to the attachment of alveolar crest. Alveolar crest are the most cervical group of fibers. They attach just beneath the cemental navel junction, and then horizontal group of fibers attach and they extend in a horizontal direction. So they are a minor group. Horizontal group of fibers are a minor group and are limited to only to the coronal 1/4 of the periodontal ligament, and their main function is to resist horizontal movement of the teeth. They resist the horizontal side to side movement and typic movement of the tooth. Next group is the oblique group of fibers. Now the oblique group of fibers is the most abundant group of principal fibers present in the periodontal ligament. Most numerous fibers are oblique group of fibers, which occupy about 2/3 of the ligament is occupied by oblique group of fibers. As you can see in the image, more areas marked by oblique group of fibers. Now the oblique group of fibers, just look at the direction. They extend in a direction opposite to that in which alveolar crest fibers have extended. Alveolar crest fibers extend from alveolar bone more cervically and insert into the cementum. Horizontal group of fibers, oblique group of fibers start from the alveolar bone, extends in an apical direction and joins the cementum more apically. So this again, the direction gives us a hint as to its function, that is, it resists vertical and intrusive forces. So if the tooth is trying to get submerged into the socket, this oblique group fibers pulls it back. So basically it's just the opposite function to that of the alveolar crest fibers. We demonstrated earlier how alveolar crest fibers will help in preventing extrusive forces by pulling it down back into the socket. Now these fibers, oblique group fibers, will prevent the intrusive movement of tooth into the socket by pulling the tooth back upwards from the socket. So they resist vertical and intrusive forces. So the most abundant type of the most common type of vertical force which befalls on tooth surface is masticatory load. Every time tooth to tooth contact occurs, there is a masticatory force which falls vertically onto the tooth surface. So as you can imagine, oblique group fibers are the fibers which prevents most of the movement within the tooth. Most of the forces which befalls on tooth is masticatory load or vertical forces. So most of the work is done by oblique group of fibers to maintain the teeth within its position. So this is the reason why we have an abundance of oblique group as compared to other fibers. Oblique group performs the most important function, so they are the most abundant in number. Next group of fibers are apical group of fibers. Apical group of fibers, as the name suggests, they are present in the apical part of the root. So this apical group of fibers, they attach, as the name suggests, they radiate from the root tip and attaches themselves to the fundus of the bony socket. They attaches themselves to the deepest part of the bony socket, that is known as the fundus of the bony socket. So this apical group, as you can imagine, in tooth which is still erupting and in which the apex of the tooth root is not completely formed, or the root is not completely formed, you cannot find apical group. It's only found at the tip of completely developed roots. So their function is that they resist forces of luxation. They prevent the, basically they prevent the uprooting of teeth from their socket. They prevent, again, tipping motion of the tooth within the socket, and also protect delicate blood vessels and nerves which are present in the apical region. Apical region, we have the apical foramen through which all the blood vessels and nerves pass into and out of the pulp from the periodontal ligament. So this area houses a lot of blood vessels and nerves, delicate blood vessels and nerves, which is also protected by the apical group of fibers. Interradicular group of fibers. Interradicular group of fibers are present between the different roots of multi-rooted teeth. As the name suggests, they are found in between different roots of a multi-rooted teeth. They extend from the interradicular septum between the teeth of different roots of multi-rooted tooth. There will be an interradicular septum, a bony septum known as interradicular septum. So these fibers extend from the interradicular septum and attaches to the furcation area of the root. Extend from the interradicular septum and attaches to the furcation area of the root. So again, as you can imagine, they are found only in multi-rooted teeth, and their function is to resist the tipping and luxation of teeth within the socket. So those are the major group of principal fibers: alveolar crest group fibers, horizontal group fibers, oblique group fibers, apical group fibers, and interradicular group of fibers. Next, the group of fibers the type of fibers which we need to know in respect to the periodontal ligament are the SHARPEY'S fibers. Now the SHARPEY'S fibers are collagen fibers of periodontal ligament which are embedded into cementum on one side and alveolar bone on the other side. As we know, one of the main functions of periodontal ligament is to provide attachment to the tooth within the socket. Periodontal ligament is a structure which provides attachment for the tooth within the socket. So what SHARPEY'S fibers do is, they are fibers of periodontal ligament which inserts itself into cementum on one side, or it will insert into the alveolar bone on the other side, thus providing anchorage to the tooth. In the images here, they actually have, this is the cementum tissue, and here you can see the alveolar bone tissue, and these are the periodontal ligament fiber structures you can see. And there will be a lot of insertion into the cementum. If you look carefully, there are a lot of insertions into the cementum, and here you can see some fibers inserting themselves into the alveolar bone also. The number of fibers which gets inserted into the alveolar bone is much less as compared to that which gets inserted into the cementum. But anyway, the part of the periodontal ligament fibers which inserts into the alveolar bone or into the cementum is referred to as the SHARPEY'S fibers. So these SHARPEY'S fibers play a very important role in anchorage of the tooth or attachment of the tooth within the socket. Next group of fibers which we have to talk about is the transalveolar fibers. So transalveolar fibers are again a type of SHARPEY'S fibers. So some of the SHARPEY'S fibers, I told you, SHARPEY'S fibers may get inserted into the alveolar bone. So once it gets inserted into the alveolar bone, they provide attachment. What happens is, sometimes they pass uninterrupted through the alveolar bone. Supposing in this image, you can see this is the alveolar bone, interdental bone septa. This is the periodontal ligament associated with this particular teeth. This is the interdental septa or bone. And on the other side, you see the periodontal ligament fibers associated with the adjacent tooth. So this is the periodontal ligament fibers associated with the adjacent tooth. Sometimes what happens is, some fibers which extend from insert into the alveolar bone passes through the length of the alveolar bone and they reach the periodontal ligament tissue of the adjacent teeth. They will start from this part, insert into the alveolar bone, become Sharpey's fibers and will extend to the adjacent periodontal. It will cross through the alveolar bone and reach the adjacent periodontal ligament area. So this is referred to as the transalveolar fibers. Because they transverses the alveolar bone, they are referred to as transalveolar fibers. These are the group of major principal fibers. So when talking about principal fibers, we should also mention Sharpey's fibers, which inserts themselves into the alveolar bone or cementum, and the transalveolar fibers, which are Sharpey's fibers, which extend from one periodontal ligament space, transverses through the alveolar bone and reaches the next periodontal ligament space. Next are the group of accessory fibers. Accessory fibers, as the name suggests, they play an accessory role in the functioning of the periodontal ligament. So the major group of accessory fibers present in the periodontal ligament are circular fibers. Circular fibers are also referred to as, this image we see here is actually a cross section of a tooth and the periodontal ligament and gingival structure associated with it. So circular group of fibers, as you can see here, you can see a circular cross section of these fibers. Okay, these fibers actually pass in a collar like manner around the neck of the tooth. They pass around the neck of the tooth, encircling the neck of the tooth, and they are also referred to as marginal ligament. Next group are the dentogingival group of fibers. As the name suggests, they extend from the teeth and extend towards the lamina propria of the gingiva. Dentogingival group of fibers. Dentoperiosteal group of fibers, which are fibers which extend from the tooth and extend towards the periosteum region of the alveolar, outermost portion of the alveolar bone, or dentoperiosteal fibers, and alveolo-gingival fibers which extend from alveolar bone to the lamina propria of gingiva. So these are the accessory fibers. The major group of accessory fibers: circular group of fibers, dentogingival group of fibers, dentoperiosteal group of fibers, and alveolo-gingival group of fibers. Apart from this, there is a very important group of accessory fibers of periodontal ligament referred to as transeptal fibers or interdental ligament. So the transeptal fibers extends from the cementum of one tooth to the cementum of adjacent tooth over the interdental alveolar crest, which means, as we saw in the image earlier, we saw how the transalveolar fibers are fibers, Sharpey's fibers, which extends or transverses through the alveolar bone and reaches the adjacent periodontal ligament. So, those are Sharpey's fibers and transalveolar fibers. So, some accessory fibers similarly pass into the adjacent periodontal ligament area, but above the level. They do not transverse through the alveolar bone, they pass above the level of the crest of alveolar bone. So these fibers, these accessory fibers, are referred to as transeptal fibers. So those are the accessory group of fibers. So these are the collagen fibers, the principal group of fibers: Sharpey's fibers, transalveolar fibers, and the various groups of accessory fibers are often referred to as the which form the collagen fibers within the periodontal ligament. Apart from this, there are two other groups of accessory fibers through, which is indifferent fiber plexus, which is often accessory fibers which are associated with the principal fibers, and intermediate plexus, which was earlier identified as a group of accessory fibers which started from both alveolar bone and the cementum and joined together at the center of the periodontal ligament space, but this was later identified as an artifact. So apart from collagen fibers, elastic fibers are also present in the periodontal ligament. which includes mature elastic fibers. These mature elastic fibers consist of a microfibrillar component which surrounds an amorphous collection of elastin protein in the center. Then they are present in the walls of afferent blood vessels and forms elastic laminae of larger arterioles. They within the wall of large arterioles present in the periodontal ligament, they form the layer of elastic laminae. There are also a lot of immature elastic fibers present within the periodontal ligament, referred to as the oxytalin and ilianin fibers. So oxytalin and ilianin fibers are immature elastic fibers which attaches to the wall of the blood vessels. They attach to the wall of the blood vessels and on one side, and other side will attach to the either the wall of cementum or alveolar bones. Thus they stabilizes the blood vessels within their position. So they are numerous in the cervical region and they control the blood flow to cervical region. Next we will be talking about the cells of periodontal ligament. So the different cells present in the periodontal ligament, we can classify them into synthetic cells and resorptive cells mainly. Synthetic cells involve osteoblasts. Since the periodontal ligament is surrounded by two mineralized tissues, bone and cementum, a lot of the synthetic depositive and resorptive action of both those mineralized tissues are carried out by cells which is supplied by the periodontal ligament. So synthetic cells in the periodontal ligament include osteoblasts, fibroblasts and cementoblasts, and resorptive cells of periodontal ligament include osteoclasts, again fibroblasts and cementoblasts. Apart from this, there will be a lot of progenitor cells, defense cells and epithelial cell rests of molasses will also be present in periodontal ligament. So talking about the various synthetic cells, first one is the osteoblast. Osteoblasts are plump cells with a large round nucleus. In the active state, there will be plump cells with plump nucleus, large cells with round to oval cells with plump nucleus, which will be found bordering the trabeculae of the bone. And as the bone becomes more inactive, they will become more flattened with flattened nucleus and become osteocytes. So here you can see large plump nucleus which are surrounding or rimming the periphery of the bony trabeculae. So these are the osteoblastic cells. As the bony trabeculae undergo rest period, they will also become dormant. Cementoblasts again are the cells which are present which give rise to or deposit cementum. They will be found lining the cementum which has been deposited. They will be found lining the cementum which has been deposited. Features quite similar to the osteoblasts with large plump nucleus if they are in an active stage. Osteoclasts are multinucleated giant cells which are found on associated with the tooth or bone surface along with concavities on the bone surface known as Howship's lacunae. Okay, there will be concavities on the bone surface which is usually representative of the bone resorption that has already started. You will see giant cells. So this is a representative picture and this is an actual image of an osteoclast in which you will see a lot of nucleus. Up to 40 nuclei can be seen in an osteoclast. They are multinucleated giant cells which causes bone resorption and are often always associated with the semicircular shaped concavity on the bone surface known as Howship's lacunae. The major group of cells present in the periodontal ligament are fibroblasts. Now this fibroblasts, as we can imagine, most of the periodontal ligament is made up of collagen fibers, and as a result most abundant cell in the periodontal ligament is also fibroblasts. So fibroblasts are usually plump, spindle shaped or fusiform cells which may show multiple cytoplasmic processes. They may be spindle shaped cells, so sometimes they also have a fusiform shape with multiple cytoplasmic organelles. So the cells will be usually distributed throughout the periodontal ligament, and often they will be oriented parallel to the long axis of their long axis will be parallel to the direction of collagen fibers within the periodontal ligament. The cells have an active synthetic function because fibers keep on, the turnover rate of periodontal ligament fibers is very high, and as a result these cells are constantly in an active state, so they will have extensive cytoplasm with abundant cell organelles. So they will have a very large nucleus which occupies a large volume of the cell and contains one or more prominent nucleoli, and a lot of active fibroblasts will be seen with extensive network of rough endoplasmic reticulum and Golgi apparatus and abundant secretory granules which contain procollagen molecules. So they will be in a state of constant activity. Fibroblasts also secrete along with collagen fibers. So they secrete mostly collagen fibers. They also secrete elastin protein, elastin fibers, glycoproteins and glycosaminoglycans. The fibroblasts, especially the ones in periodontal ligament, also have well-developed cytoskeleton. They have well-developed cytoskeleton with a particularly prominent actin network. Their actin network will be present very prominent within the cytoskeleton, which will provide contractility to the cells. So these cells will be attached to the surfaces of the periodontal. As you can see in this is an electron microscopic image of the periodontal ligament, and what you see in the fusiform shape here with multiple cytoplasmic processes is the fibroblast. You can see the fiber bundles extending. These are collagen fibers extending, and you can see the fibroblast is attached to this collagen fibers. So the actin cytoskeleton will give contractile properties to the fibroblast, which will in turn exert this contractile property onto the collagen fibers, and which will help in contractility of the periodontal ligament. Remember, periodontal ligament plays an important role in absorption, shock absorption during mastication. So this function, this contractile property provided by the actin filaments, the fibroblast, and the attachment with the collagen fibers plays a very important role in providing that contractility to the whole periodontal ligament. So as you remember, we mentioned fibroblasts are both synthetic and resorptive cells, as they perform a dual function. They both synthesize and degrade collagen fibers. Thus, that's the reason they maintain a very high turnover rate of fibroblasts, which is the highest turnover rate of fibers within the body is happening in the periodontal ligament, and the reason is the fibroblasts perform both the dual functions. So this degradation of collagen fibers is actually a complex process which has an extracellular step and an intracellular. It includes extracellular events as well as intracellular events. So the extracellular events include the fibroblast secreting enzymes such as collagenases and matrix metalloproteinases, which break down the collagen fibers into smaller molecules, which are then phagocytosed by the fibroblast itself. They will secrete all these enzymes which break down the collagen fibers into smaller molecules, which are phagocytosed by the cell, and then within the cell, intracellularly, lysosomes combine with these components, broken down components of collagen fibers, and form phagolysosomes, where enzymatic degradation of the collagen fibers occur. So that's how fibroblasts perform their function. Next group of cells present in the periodontal ligament are progenitor cells. Now these progenitor cells, as the name suggests, they are the stem cells of periodontal ligament, which are multipotent cells which can differentiate into any cells according to the requirement. As we know, periodontal ligament houses the synthetic and resorptive cells of all the three tissues, alveolar bone, cementum, and the periodontal ligament itself. So this helps the periodontal ligament in maintaining the tissue homeostasis, that is, maintaining the structure of the periodontal ligament as it is. So these progenitor cells, according to requirement, they can differentiate into fibroblast, osteoblast, or cementoblast, and they can perform morphogenesis, cytodifferentiation, extracellular matrix formation, and mineralization. So these are multipotent cells which can differentiate into any of these synthetic or resorptive cells. The progenitor cells will be clustered mostly around blood vessels. As with other stem cells, they will be found mostly close to blood vessels, there will be small sized cells open with a closed phase nuclei, that is, there will be an inactive stage, and they are highly responsive to stimulating factors. Various growth factors, etc., will have to play a role in stimulating them so that cells become active. Then another important group of cells present in the periodontal ligament are the epithelial rests of molasses. Now, epithelial rests of molasses are the remnants of Herdwick's epithelial root sheath. Herdwick's epithelial root sheath plays a very important role in the formation of root, in the development of root of teeth. So, this epithelial rests of molasses are remnants of some Herdwick's epithelial root sheath which fail to disintegrate with time. So, they will be found in periodontal ligament in the form of closely packed cuboidal cells with a darkly stained prominent nucleus. They will be found as clusters or islands or networks or strands of, or as we can see here, tube-like structure of cells, collection of cells which will have very dark prominent, darkly stained prominent nucleus and scant cytoplasm. As you can see here we have a roughly tube-shaped arrangement of epithelial rests of molasses. These cells are separated from each other by it's separated from the surrounding connective tissue by a basal lamina-like material and eosinophilic material which resembles basement membrane. The cells will have abundant mitochondria with poorly developed rough endoplasmic reticulums and Golgi bodies. The cells will be attached to the set basal lamina-like material through hemidesmosomes, and the number of this epithelial rests of molasses, they will be found mostly close to the apical region during the initial stages of life, that is during that development of, when the development of root of teeth is still happening, we will see epithelial rests of molasses more close to the apical region of the root, but during the second decade of life you will see the epithelial rests more closer to the furcation area. As the roots develop further, we will see the epithelial rests of molasses more close to the furcation area. With age, usually the number of epithelial rests of molasses decreases. Ideally, they will decrease. Sometimes they may proliferate to form cysts or tumors. These epithelial rests of molasses, which are supposed to be inactive cells present in the periodontal ligament, sometimes under some abnormal stimuli they may start to proliferate and they may lead to formation of odontogenic cysts or odontogenic tumors, or some may undergo calcific degeneration to form cementicles within the periodontal ligament. So most of them perish, disintegrate. Some may undergo formation of cysts or tumors or may transform into cementicles. Finally, periodontal ligament contains different defense cells. Defense cells include mast cells and macrophages. Mostly they contain mast cells and macrophages. Occasionally eosinophils are also present within the periodontal ligament. We also see lymphocytes and plasma cells, etc. under some conditions. So these are the various cells present in the periodontal ligament. So with that we conclude the various fibers and cells present within the periodontal ligament. Thank you.